360 view of the room. There's SEMA. And then paper. It's blank. Okay. Alright, before we begin, I've just wanted to make a note. I've already conducted a health history on my patient where I've collected the history of the present illness, past medical history, family history, surgical history, social history, collected a list of medications, and then educated on tobacco cessation, alcohol, and caffeine use. Alright, so I'll go ahead and provide privacy. Hi, my name is Christina. I'm a nursing student. I'm here to conduct a head-to-toe assessment on you today. Can you tell me your full name and date of birth?
Seema Masses, April 21st, 2001.
Alright, and do you have any allergies?
No.
Alright, so again, I'll be conducting a head-to-toe assessment. Basically what that means is I'll be going through each body system, starting with your head, moving down to your toes, collecting some findings to get an overall view of your health. Do you have any questions before we get started?
No.
Alright, sounds good. Can you go ahead and restate your name for me?
Seema Masses.
Okay, and then where are we located right now?
Mesa.
Alright, and then what month and year is it?
It is November 2025.
Alright, patient is alert, responsive, and oriented to person, place, and time. Patient is sitting upright at the edge of the bed. Overall mood, affect, and facial expressions are appropriate to the current situation. Do you use any assistive devices to help with mobility?
No.
No? Okay. Patient is independent with mobility, no use of assistive devices, and no tubes, lines, dressings, or machines that would negatively impact mobility. Do you have any pain right now?
No.
Nope. Okay. Patient denies pain at this time. Now I'm going to collect some vital signs on you. That includes your blood pressure, pulse, oxygen saturation, temperature, and heart rate. We'll go ahead and start with your temperature. I'll do an oral temperature. But before I do this, have you had anything to eat or drink that's hot or cold within the last 30 minutes?
No.
No. Have you exercised or smoked within the last 30 minutes?
No.
Oh, okay. So I'll give you this probe to put underneath your tongue. Just gently close your lips around it, but do not bite down. All right, 98.6 degrees Fahrenheit. Good. Now I'm going to get your heart rate. I'm going to use your radial pulse for this. If the rate was regular, then I would count for 30 seconds and multiply by 2. If it was irregular, then I would count for a full minute. Okay, your heart rate was 82 beats per minute and your respirations were 18 breaths per minute. Now we'll go ahead and get your blood pressure. We'll do this the two-step method. Have you had any mastectomies or lymph nodes removed? Okay. Do you have a dialysis port? No, or fistulous? Okay. And then you have no IV lines in. Do you have an arm preference? Okay. Okay, so I'll first start by palpating the brachial pulse, and then I'll pump it up until I can no longer palpate it, and then I'll use that number to add 30 to when I collect the actual blood pressure. Okay, I stopped palpating the brachial pulse at 130, so I'll pump it up to 160. But first we'll take a 1-minute break and I'll get your oxygen saturation. Do you have any artificial nails or nail polish on?
No.
Okay, great. So go ahead and use your finger. If I wasn't able to use your finger, I would use your earlobes or toes or the bridge of your nose. Okay, so the waveform is consistent at 99% on room air. Alright, so after waiting 1 minute, I'll go ahead and get the blood pressure. Alright, your blood pressure was 116/70. Alright, great. So now I'm going to give you 3 words to remember. I'm going to ask you to repeat these words at the end of the assessment, and they are shirt, pencil, and flower. Alright, now we'll move on to do the cranial nerves. We'll start with cranial nerve 1, olfactory nerve. I'm going to give you 2 scents to smell. I'll start by having you close your left nostril and let me know what you smell.
Lemon.
Okay. And then I'll have you close the other nostril.
Coffee.
Alright, cranial nerve 1, olfactory nerve is intact. For cranial nerve 2, optic nerve, since we don't have a Snellen chart in the room, I'll verbalize what we would do. I would have the patient stand 20 feet away from a Snellen chart. If they're wearing glasses or contacts, I would have them keep it on. Then I would have them close one eye at a time and verbally read back the smallest line that they're able to see, and then do this again with both eyes uncovered. If they're able to read more than 50% of the line, then cranial nerve 2, optic nerve is intact. For cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and cranial nerve 6, abducens, I'm going to do the 6 cardinal fields of gaze. So I just want you to follow my pen light for me as I move it in different directions. Okay, cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and cranial nerve 6, abducens is intact. The nystagmus noted bilaterally. Alright, cranial nerve 5, trigeminal nerve. I'm going to touch a few places on your face. Let me know if you feel dull or sharp.
Dull. Dull. Sharp. 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 Dull.
Alright, cranial nerve 5, trigeminal nerve is intact. Cranial nerve 7, facial nerve. I'm going to have you smile real big for me. Nice teeth. Now frown. Now puff out your cheeks. Great. Cranial nerve 7, facial nerve is intact. For cranial nerve 8, acoustic nerve, I'm going to stand 2 feet behind you on each side of your ear. I'm going to whisper a phrase. Just repeat that back to me, okay? I hope we pass head to toe.
I hope we pass the head to toe.
Is it hot in here? Is it just me?
Is it hot in here or is it just me?
Alright, great. Cranial nerve 8, acoustic nerve is intact. For cranial nerve 9, glossopharyngeal, I'll go ahead and verbalize what I would do. So I would have the patient open their mouth and stick out their tongue and say ah as I observe the uvula as it rises and falls with phonation. And then I would use a tongue depressor to push it all the way back and as close to the pharyngeal wall as I could. If the patient has a gag reflex, then cranial nerve 9, glossopharyngeal nerve is intact. For cranial nerve 10, vagus nerve, I'm going to give you a cup of water and ask you to take a sip to see if you're able to swallow with ease. All right, great. Cranial nerve 10, vagus nerve is intact. For cranial nerve 11, spinal accessory, I'm going to have you stand up and face the wall. I'm going to apply some resistance on your shoulder. Just go ahead and shrug against that resistance. Great. Cranial nerve 11, spinal accessory nerve is intact. And then finally, cranial nerve 12, hypoglossal. I'm going to have you stick out your tongue for me. Now point it up, down, side to side. All right, great. Cranial nerve 12, hypoglossal nerve is intact. All right, now moving on to the head and neck portion of the assessment. I'm going to have you sit on the lie back. Just going to raise the bed to a comfortable height. So I'm first going to make some observations and then palpate some areas on your scalp. Let me know if you feel any pain or tenderness. All right. So head is normocephalic in shape, face is symmetrical. No lumps, lesions noted. Did you feel any tenderness? No, okay. No tenderness upon palpation. All right, and now I'm going to check your trachea and your thyroid. So for your trachea, I just want you to slightly tilt your head up toward the wall. All right, trachea is midline. And then I'm going to have you, to check your thyroid, I'm just going to have you swallow for me as I cradle your thyroid cartilage to check for any nodules or lumps. All right, great. No nodules noted, no thyroid enlargement noted either. And then finally, for cervical lymph nodes, I'm going to palpate each one on both sides. Again, let me know if you feel any pain. So preauricular, postauricular, occipital, tonsillar, submandibular, and submental. All right, cervical lymph nodes are non-palpable and non-tender bilaterally. Now we'll move on to the eyes. So first I'm going to just make some observations, and then I'm going to check your pupils. I'm going to first lower each one of your eyelids. Okay, eyes are intact and equally aligned. Conjunctiva are pink, sclera are white, no jaundice or drainage noted. All right, now I'm going to check your pupil size using my pen light. Okay, pupils are 3 millimeters in diameter bilaterally. Now to check your, going to check for perla. First I'm going to check for direct response. So I want you to just look straight ahead for me as I shine a light obliquely into your right eye. I'm going to see if the pupil that I shine the light in constricts. Okay, and then I'm going to do the same thing on the other side. All right, and now to check for consensual response, I'm going to do the same thing, except as I shine the light in the right eye, I'm going to look to see if the left eye constricts. All right, and now I'm going to check for accommodation. So I'm just going to have you first look at my pen light, and then straight ahead at the mirror, and then back at my pen light, and then at the mirror. Okay. And then for convergence, I'm going to move this all the way up until your nose to check for convergence and to see if your eyes move cross-eyed. All right, perfect. So pupils are equal, round, and reactive to light, both direct and consensual, and accommodation bilaterally. Convergence is noted. All right, and then I'm going to check the ears, nose, and throat next. So now I'm just going to just pull your ear this side. Sorry. And then I'm just going to palpate your ears, so let me know if you feel any pain. All right. So ears are intact and equally aligned. Did you feel any tenderness? No? Okay. No tenderness noted upon palpation. No swelling, lesions, or drainage noted. Now I'm going to check your frontal and maxillary sinuses. I'm going to do this bilaterally. Just again, let me know if you feel any pain. So frontal maxillary. All right, frontal and maxillary sinuses, non-tender, non-palpable bilaterally. And now I'm going to check your nose. First, I'm just going to make some observations. So nose is midline, and then I'm going to check inside your nostrils. And I'm going to have you close one at a time. Are you able to breathe easily through both? All right. And then no history of nasal polyps, facial trauma. Okay, just checking for obstructions. So nose is midline, no swelling, drainage, or lesions noted. Nares are patent bilaterally. All right, and now finally for your mouth, I'm just going to have you open and say ah.
Ah.
All right, all teeth are present, no dentures, no cavities noted. Tongue and oral mucosa are pink and moist. No lesions, sores, or white patches noted. Tonsils are not swollen or inflamed. All right, now we'll move on to the respiratory part of this assessment. So first I'm going to just make some observations. So patient is sitting upright and is on room air. Appropriate inspiratory and expiratory effort. Respirations are non-labored. Now I'm going to test your chest expansion. So I'm just going to have you take a deep breath as I put my hands over your chest with my thumbs together. And as you take a deep breath, I'm looking to see if my thumbs slightly separate. And then I'll do the same thing on the other side. Deep breath. Okay, equal chest expansion noted on anterior and posterior chest bilaterally. Now I'm going to auscultate, listen to your lung sounds. So for the purposes of this video, I'll be auscultating over clothing. Normally I would do this stethoscope to skin. So I'm going to use the diaphragm of my stethoscope to move it in different places. Each time I move it, just take a deep breath, okay? Okay, and now I'm going to do the same thing on the posterior side. I'll just have you cross your arms over your chest to increase the surface area around your posterior lobes. And then I'll do the same thing in a ladder fashion. Okay, thank you. You can sit back down. Okay, so lung sounds are clear on anterior and posterior lobes bilaterally. No adventitious lung sounds noted. Now we'll move on to the cardiovascular assessment. So first I'm going to check for capillary refill on your fingers. I'm going to pinch the nail bed and see if the blood flow returns in less than 3 seconds. If the patient was wearing nail polish, then I would use the side of the nail bed to do this. So I'm going to do each of the 10 fingers. Okay. Capillary refill is less than 3 seconds on all fingers bilaterally. I see that you're wearing socks. Is it okay if I check the capillary refill on your toes?
I prefer not.
Okay, no worries. So for the comfort of my patient, I will not be checking the capillary refill on her toes, but normally I would do the same procedure on all toes to check for capillary refill. Now I'm going to check for clubbing on the fingers. I'm just going to look for rounded fingernails. That could indicate hypoxia. Okay, no clubbing noted on all fingers bilaterally, and again I would do the same thing on all 10 toes. All right, now I'm going to palpate your carotid arteries one at a time. Okay, carotid arteries are palpable and 2+ bilaterally. Now I'm going to check for bruits over the carotid arteries using the bell of my stethoscope. And again, I'm doing this one at a time. Okay, no bruits noted over carotid arteries bilaterally. Now I'm going to check for jugular vein distension. So I'm going to have you look 45 degrees to your left. I'm going to use the pen light, my pen light, to look for any bulging or pulsations. Okay, I'll do the same thing on the other side. Okay. No jugular vein distension noted bilaterally. All right, now I'm going to listen to your heart sounds. For the purposes of this video, I will be auscultating over clothing, but normally I would do this on direct skin. So first I'm going to listen to S1 and S2 heart sounds using the diaphragm of my stethoscope. And I just want you to breathe normally as I move this time. So first I'm going to go down to the second intercostal space, left sternal border, or right sternal border, and listen to the aortic valve. Then I'll move across to the second intercostal space, left sternal border, and listen to the pulmonic valve. Then moving down to the third intercostal space, left sternal border, to listen to Erb's point. And then the fourth intercostal space, left lower sternal border, to listen to the tricuspid valve. And then finally, fifth intercostal space, left midclavicular line, to listen to the mitral valve, otherwise known as the apical pulse. All right, now I'm going to do the same thing, except using the bell of my stethoscope to listen for S3, S4 heart sounds, and murmurs. So again, going to the aortic valve, pulmonic valve, Erb's point, tricuspid valve, and mitral valve. All right, S1, S2 heart sounds noted, regular rate and rhythm. No S3, S4 heart sounds or murmurs noted. Now I'm going to palpate your peripheral pulses. So I'm going to do this on each side, starting with your radial pulse. Okay, and then I'll go and check the brachial pulse. Okay, and then I'll check, I won't check the femoral pulse, but that's in the inguinal fold. Normally I would do that and press firmly. For popliteal, I'll do behind the knees. Usually that may be easier if the patient is lying prone, but I'll just check it here. And then posterior tibialis on the inner ankles. And then dorsalis pedal pulse on the top of the feet. All right, all peripheral pulses are palpable and 2+ bilaterally. And now finally I'm going to check for edema. So I'm going to check on all arms and legs. I'm going to press firmly for 5 seconds and look for any indentations. If I did see an indentation, I would measure it and then see how long it takes to return back to normal or to flat, and then I would grade it accordingly. I don't see any pitting edema noted. So no pitting edema noted on arms and legs bilaterally. All right, now we'll move on to the skin assessment. So for the purposes of this video, I will only be assessing the skin that's comfortable and exposed for my patient. Normally I would assess the whole body. So in this case, I'll be assessing the arms and then upper chest and face and neck. So skin on face, neck, arms, and chest are warm and dry, no discoloration noted, no lesions, scars, or bruises noted. And now I'm going to check for skin turgor. So I'm going to pinch the skin on your clavicle to look for any tenting. Okay, skin turgor intact, no tenting noted. All right, moving on to the abdominal assessment. I'm going to raise the bed and then lie you flat. For the purposes of this video, I will be assessing the abdomen over clothing. Normally I would assess this on direct skin. Yeah, I'm just gonna raise it a little bit more actually. Oh wait, sorry. Wrong button. Okay. Alright, abdomen is flat and symmetrical. Hair distribution is noted. Hair distribution is as expected. No bruises, scars, or pulsations or lesions noted. And now I'm going to listen to your bowel sounds. And so I'm going to use the diaphragm of my stethoscope to listen for normal, active, hyperactive, or hypoactive bowel sounds. If bowel sounds were absent, I would listen for a full 5 minutes in each quadrant. Okay, so I'll start in the right lower quadrant. Okay, right lower, right upper, left upper, left lower. Okay, normal active bowel sounds in all 4 quadrants. And now I'm going to listen for bruits over the abdominal aorta using the bell of my stethoscope. Okay, no bruits noted over the abdominal aorta. And now I'm going to check for inguinal and umbilical hernias by performing the Valsalva maneuver. So I'm just going to have you bear down for me. Okay, no evidence of inguinal or umbilical hernias noted. And then finally, I'm going to lightly palpate each of the 4 quadrants. Let me know if you feel any pain or tenderness. I'm going to lightly palpate 2 to 3 spots in each quadrant, starting with the right lower, right upper, left lower. Did you feel any pain? No. Okay. No lumps or lesions noted in our 4 quadrant. Patient denies any pain or tenderness. All right, now I'm going to do the musculoskeletal assessment. So I'm going to lower the bed to the lowest setting. That is really low. Okay, now I'll raise the bed. Okay. All right. So for the first test, I'm just going to have you stand up and then walk towards the camera as you normally would. Okay, and then when you turn back, walk heel to toe. All right, so gait is steady, balance appears intact, patient ambulates independently. Now I'm going to check each of your joints. So I'm just going to move each joint to check for any crepitus, swelling, or tenderness. So I'll start with your shoulder. And do the same on the other side. Okay, and then your elbows. Okay, and then your wrists. And then your hips, I'm just going to move it. Okay. And then your knees. And then finally your ankles. All right, you can have a seat. Thank you. So all joints, no swelling or tenderness noted in all joints bilaterally. Now I'm going to check the curvature of your spine. Sorry, I'm going to have you stand back up for me. And then slightly bend your back so I can check for any abnormal curvatures or lumps. So I palpate. Okay, spine curvature is as expected, no lumps or lesions noted. And now I'm going to check your range of motion, so I'll just have you mirror my movements for me. Arms, elbows, shoulders, hips, knees, and then ankles, just rotate. Okay, great. So equal range of motion in all joints bilaterally. Now I'm going to perform the Romberg test to check your balance for swaying. So I'll have you stand in front of me with your eyes closed. And I'm going to have you close your eyes for about 10 seconds as I put my hands on either side to check for swaying. Alright, I do that for 10 seconds. Think you could have a seat. Negative Romberg test, no swaying noted. And now I'm going to check your memory. So I'm just going to ask you a few questions. Just answer as best as you can. Do you remember what city you were born in?
San Francisco.
All right. And then what were those 3 words that I asked you to remember at the beginning of the assessment?
Shirt, pencil, and flower.
All right. Patient's immediate, recent, and remote memory are intact. And now finally I'm going to check the deep tendon reflexes. For the purposes of this video, I will only be assessing the patellar deep tendon reflex, but the other ones are the radial, brachial radialis, tricep, patellar, and then Achilles. Okay, so I'm just going to raise the bed.
Okay.
Okay.
Good?
Okay. All right, patellar deep tendon reflexes are present, brisk, and 2+ bilaterally. All right, that concludes my assessment. I'm just going to lower the bed to the lowest setting, and I'll have you sit back down. All right, and then I'll raise the side rail up. Oops. I'll give you the call lights. Do you have any questions before I leave you?
No.
All right, if you need anything, just let me know. All right, thank you.